The first problem in any analytics project is to define and retrieve the data you need in order to do your analyses. That's the job of the Population Health Management Query Builder tool. So let's take a look. First, I'm going to sign in with my Active Directory account. And then I'm presented with the My Projects page. This is where I can see projects that I've already started and their status. I haven't got any at the moment, so let's start a new one. First, I had some basic details, like a name, and a description. Then I choose a community. This list is based upon a user's role, and a user can belong to one or more communities. Next, I choose the patient cohort this analytics project is for. The list here will depend upon the community I belong to. Finally, I choose the level of de-identification for the project. The two choices are pseudonymized, whereby a patient can be re-identified if necessary, or anonymized, where that is not possible. The next screen is the Dataset Definer canvas. This is where we will start to add in the datasets that we need and link them together. All datasets are based on HL7 FHIR resources, and we see that we are giving a starter dataset of the patients. This is based on the cohort we selected. Next, I'm going to say that we want to see the referrals that these patients have had. So the resource I'm going to choose is the FHIR referral request resource. And we see the dataset definer here links the two together. So this says that I want all the referral requests that are for these patients. I can further narrow this down with this pencil icon, which brings up the filter lists. For example, I might only be interested in referrals since the start of the year. So that has added a filter to my dataset, and I can add many of those if I require. Next, I'm interested in consultations that the patients might have had as a result of those referrals. This is based on the FHIR Encounter resource. And in order to link it to the referrals, I simply drag and drop. Then I might be interested in the treatments the patients had as a result of those consultations. So again, I pick the appropriate FHIR resource and drag and drop. And in this way, I'm building up a pathway that we're interested in. Finally, I'm interested in the comorbidities for the patients. But I'm interested in all their conditions, regardless of encounter, so I simply link this directly to the patient cohort. And now I have my finished datasets, so I can go on to the next stage. Here I'm presented with a summary screen which shows me the datasets that I've defined and what action will be taken when I click the Run button. So here it's simply saying that these datasets will be submitted to the system of systems so it can satisfy those queries. So I'll go ahead and do that. And that returns me to the My Projects page. What's happening now is that those queries have been submitted to the system of systems. It will satisfy those asynchronously, and then the results will be retrieved by the data collector. The data collector will then take the results and pass them through a pipeline where they will be enriched and de-identified before being passed on to the analytics store so that they can be used in the creation of dashboards.
The purpose of the analytics work completed so far is to prove the end-to-end data flow from Rotherham test systems through to the Google Cloud Platform, or GCP, and then into a dashboard. The integration engine de-identifies the data ahead of it being used for analysis. The analytics work starts with the integration engine pushing the test data into the associated bucket in GCP. Once the data lands in the bucket, a Python script is run to load this into BigQuery. The tables of interest are currently patient, condition, procedure, and encounter. After a series of workshops and interviews with analytics and clinical leads across the region, we agreed to focus on the living with and beyond cancer use case. The purpose of this dashboard is to define the cancer population across the Yorkshire and Humber region and help clinicians to identify potential opportunities for PHM improvements. As a quick reminder, this dashboard is built on synthetic data. Real data will flow into the solution when it becomes available. As a clinician, I can open up the tool and can quickly identify that most of the hospital activity is concentrated in the 45 to 65 age group, coming from the most deprived areas of the region. Clicking on this will give me a more in-depth look into these patients. I can see where they're based in the region, what conditions they have, and what procedures they have had in the past. These insights can help me in identifying specific interventions in the region to improve clinical outcomes for the patients who need it most.